Next, atypical antidepressants. These are becoming more and more popular. You may already have had some patients who are taking, especially Wellbutrin, right? So there are other meds in this group, Trintellix, Vibrate, Desril, and Remeron. So these medications have different mechanisms. They are not all the same. And they put them in this category of atypical because of their mechanism of action. So I put the mechanism here, not in a separate slide. I'm going to just briefly mention that. So vortioxetine or Trintellix and then Vibrate basically are SSRIs with an addition of working on a specific autoreceptor in the brain. In terms of Desirel, this also works on the serotonin pathway, and it is an uptake inhibitor and antagonist. Bupropion, Wellbutrin, which is a very popular one, works on norepinephrine and dopamine receptors, and it doesn't impact the certain receptors. And for that reason, it doesn't have sexual side effects and is a popular one with depression patients. Remeron or mirtazapine, it works on adrenergic or norepinephrine pathways, has some impact on serotonin receptors and antihistamine receptors as well. So for those reasons, it can be sleep-inducing and it can increase appetite, which has its own indications for use in certain patient populations. Indications of atypicals are similar to the other antidepressants. In addition to nicotine use disorder for bupropion or Wellbutrin, as FDA-approved indication, also off-label, bupropion is prescribed for ADHD. It may help. The evidence is equivocal, but in some cases, a improvement in attention has been reported. It definitely helps with the weight loss. It decreases appetite. And there's also some evidence that may be helpful with stimulant use disorder or a stimulant disorder, basically. And for insomnia, trazodone and mirtazapine, two medications from this group, are commonly used for insomnia. In terms of considerations for prescription, their timeline of efficacy is similar to the other antidepressants. Wellbutrin is really good for anergia as an additional symptom domain, in addition to low mood, negative self-appraisal, avoidance, anhedonia, and irritability. Side effects, some of them may appear very immediately. For some of them, it takes a few days. Those that are important are the increased risk of seizure in high-risk population with bupropion or Wellbutrin. So if someone has a seizure history or epilepsy, we would want to avoid Wellbutrin them. There's some nausea that is usually transient. Some people may experience insomnia with some of these medications. Sedation is usually a favorable adverse effect, which we use some of these medications for inducing sleep, as I mentioned before. And these medications usually cause less sexual dysfunction than SSRIs and SNRIs. And with mirtazapine, usually there's a significant weight gain because it improves appetite. And for that reason, it actually is a good medication in certain types of cancer patients that might have experienced weight loss and depression together.